Hi there. For this assignment, I have decided to relate everything to boxing and Taekwondo, two sports that I know really well. Now, the first thing I want to talk about is the planes of motion. Taekwondo and boxing take place in all three planes of motion, that is the frontal, sagittal, and transverse planes. Now, for this presentation, I will be talking to you from an anterior point of view, demonstrating from a lateral point of view. I will not be using the posterior point of view. Now, one of the things I want to talk about is the hand wraps that I'm using. I use these to protect my digitals, the dorsum and small bones in the back of my hands, and my carpals. Now, first I want to talk about a distal punch. A jab would be considered a distal punch, whereas a hook would be considered proximal, as it is closer. Now, the other difference between the two, jabs are straight line punches, medial punches thrown to the center line of the body, whereas hooks are thrown to the lateral side on the side of the body. Now, next we'll talk about target areas. Now, target areas are cephalic, cervical, thoracic, abdominal, and pelvic. Now, starting at the cephalic area, main thing I'm aiming for is the mental. The other thing is, I'm also aiming for the face in general to create superficial damage on the face. When I'm working on the body, I'm looking to do damage to the costal and sternal bones, as well as deep tissue organs such as the liver and spleen. Now, the next thing we also do when we're trying to do damage to the body is we're doing damage to the brachials and antebrachials, which are used for blocking primarily. Now, next, I'd also like to talk about the fact that, I'm a little uncomfortable with saying this, but my arms are superior to my legs. My legs are inferior to my arms, anatomically speaking. But I actually consider them to be equal because the sural and femoral muscles in my legs are very powerful and very capable of inflicting a lot of damage. Now, that has been my brief presentation on anatomy.